Hello and welcome. What we're going to basically take a look at now, which is something I get asked by a lot of my students and a lot of colleagues, what is the difference between acupuncture and dry needling? Is one better than the other? Well, the answer to that is I wouldn't say one's necessarily better than the other, but if I had to choose between the two, I would choose my classical acupuncture points over dry needling. It does have several advantages over dry needling, which we'll take a look at. But when I choose classical acupuncture points, I do not choose them primarily based on a TCM basis. I still use a Western scientific understanding of key points, the physiology of those particular points. So that's how I tend to generally choose my points. Therefore, I know that the point's going to do what I intend it to do. So what we're going to basically do now is to take a quick look at the difference between acupuncture, regardless of whether you're using it from a TCM viewpoint or a Western scientific viewpoint, and also dry needling. So that's going to be one of the key things that we're going to take a look at and see what the difference is. So hopefully by the end of this short presentation you'll have an understanding of what is dry needling and what is classified as acupuncture. Also an understanding of the similarities and differences between acupuncture and dry needling. And also what is the correlation between the two. Now, just before we go any further, one of the key things that I just want to make quite clear is we do need to define the term acupuncture. Acupuncture, break it down into acupuncture. Basically, acu is needling and also puncture is breaking the skin. So it is any form of needling where it's going to penetrate the skin. That is important to understand that. So therefore, dry needling in itself is actual acupuncture. It's just more or less a terminology which is used by Western medical practitioners. And same again, dry needling forms part of traditional Chinese acupuncture. So it's part of what they do. They'll classify that as ashi points. And what Western medicine has actually come along and done is taken a part of traditional Chinese acupuncture and utilise that and made it more evidence-based in its practice. So therefore it's more understanding to Western medical practitioners. You can apply that to traditional Chinese and also apply that to your classical acupuncture points, which I'll get a little bit more into as we go along. So it's how you want to actually utilise each part of this. So what is dry needling? Dry needling, as I was saying before, is mainly used by healthcare professionals, doctors, nurses, physiotherapists, sports therapists, massage therapists. It's mainly used primarily to address myofascial trigger points, and it's mainly targeting pain as opposed to any other form of treatment. Needling wise, normally it's a 25 to 30 mil gauge needle that's actually used, and again depth wise they'll utilise from a superficial, which is 3 to 10 mil, to a deep, which is 1.5 to 3 mil. However, there are colleagues that I do know of that will needle a lot deeper. One of the key things what I do say when it comes to needling, you do need to look at the research out there, and the research will demonstrate the difference between deep and superficial when it comes to treating myofascial trigger points. And if you purely look at that, there's no significant difference. But however, some school of thought is out there advocating deep needling, and this is where some problems with dry needling tends to come in, where there's a lot of people getting neurothorax from that, particularly when you're needling onto the torso. So again, look at the needling technique. Fanning is one of the key needling techniques that's taught within dry needling, and it does come with its problems. It does cause more pain, but again, look at the studies. There's a number of studies that's out there that will show you the difference between superficial, sparrow pecking type needling technique, where you're just going to grasp the needle and just do very small oscillatory movement. You're not really gliding the needle up and down, or fanning, where it's literally like you're taking an ice pick and going in at different angles into the structure. Now you look at the studies that's actually compared the two, and looking at long-term, short-term treatment outcome, no significant difference. However, your fanning will cause more pain and discomfort to the actual patient. So that is something that's not generally taught on these courses. So therefore there should be evidence-based when they're actually being taught. Training wise for dry needling is only 2 to 6 days, which is fine because it doesn't take much to learn the needling technique. One of the main things that I would say, which I do find a problem, is some of the instructors are what I would call not fully qualified. You do need to be qualified to a certain level. I mean, I've taught dry needling courses and I've taught for a number of different organisations, such as the Acupuncture Association of Chartered Physiotherapists, which is one of the biggest acupuncture organisations in the world. Also, the British Medical Acupuncture, they recognise the courses that I run. And what you've got to bear in mind with that is, in order to teach for each one of those organisations, you do have to have a minimum standard of qualification in order to teach. And same again, if you taught for other reputable organisation, you do have to have a minimum. For the Acupuncture Association of Chartered Physiotherapists, when I registered with them, you had to have a minimum of 200 hours of training in acupuncture. And that's training, not attending workshops or something like that. It's proper training. In addition to that, you had to have a teaching qualification. So you had to meet minimum standards in order to be able to go out and teach any of their courses. And same again with the British Medical Acupuncture Society, BMAS, you have to have a minimum standard of training and a minimum standard of qualification in order to teach. But however, there's a lot of courses, dry needling courses, where people are teaching now and all they've done is a short 2 to 6 day training. So that is causing problems because there's a lot of insurance companies now with sports and massage therapists presenting with neurothorax. So that's one of the key issues, if any, that's actually out there that's being presented. As I was saying, it's mainly sports and physical therapists. Diagnosis is based on a Western medical approach. So therefore it's more evidence-based. So it does suit more Western medical practitioners, because you're going to find within traditional Chinese medicine and traditional TCM acupuncture, some of the terminologies and their understanding don't quite fit with Western medical understanding. However, you can look at the points now, classical acupuncture points, from that viewpoint, which we'll get onto a little bit in a short while. But needling is generally local, which does pose a problem. And this is where your acupuncture, your classical acupuncture points, will outperform your dry needling, because it's more local to the actual area. And because it's local, it just means that if that area is swollen, then there's going to be an issue, purely because you can't needle into that area. Whereas utilising classical acupuncture points, you can needle away from the area and still have a significant effect. Same again, dry needling, as we said beforehand, has evolved from traditional Chinese, and in most cases it's classified as the ashi points or tender points. The key thing is, if you're treating tendon and pathological tendons such as tendinopathy where it's chronic, something like that, is your dry needling does come into its own, because in that case you do need to needle more directly into the area. If it's acute, then you can't, and that's where your classical acupuncture point is going to come into its own to enhance the healing process. So that's one of the key things. It is evidence-based in its practice, but the main focus of dry needling is on pain. Now, if we was to look at acupuncture in itself, the key thing about acupuncture is the diagnosis with regards to that takes a slightly different approach, but both has been shown to be effective at treating myofascial trigger point. Classical acupuncture is where you would use more distal points away from the area. So there's two key points that have actually been demonstrated to be more effective than treating local points in the neck and shoulder. So a number of studies have actually demonstrated that. One of them is triple energizer 5 or Sangjiao 5. The other one is gallbladder 34. So studies have actually come along and explained as to how the physiology behind that. So if you're a Western medical practitioner, you can start to understand. You needle gallbladder 34, and it has actually been shown to enhance circulation to the neck and shoulder. And it's one of your main points you're going to utilise from a TCM to treat neck and shoulder disorders. Therefore, that's how it's had its benefits over local points within its actual area. But however, if I'm treating neck and shoulder problems, I would normally use a combination of dry needling local to the area, but also utilize your classical acupuncture points in order to address that. So that's what I was saying is use them both in conjunction with each other and not in isolation. So that's something to bear in mind, and there's sufficient evidence out there to demonstrate that your distal points, which TCM has actually demonstrated, can be far more effective. If I'm treating somebody with an acute back problem, again, your dry needling has got the restriction that you'd normally needle in the area. Your classical acupuncture points, normally if I'm treating acute back, I don't put any needles into the back. The needles that I'm going to utilize is, say for example, on the face, such as your Yin Tang, Do 26. Those 2 points will relax off the muscles within the back. You've got your small intestine 3 on the side of the hand here. Again, that is a very strong point for acute and chronic back pain. And then you've got other points such as your liver 3, large intestine 4. They will actually, the 4 gates that will address the pain. That will help to calm and relax the patient. So you've got very effective point. Other point that you can actually utilize is your urinary bladder 40. Now that point in itself, again, you look at the science and the evidence behind that point as to how that has an effect directly on the back. TCM will tell you that is the command point or the influential point for the back. Science have actually come along and demonstrated that that point will enhance blood circulation to the back. So that's how it has part of its effect, is enhancing blood circulation to the back. So once you start to look at that on a musculoskeletal basis, at no point do I need to put needle directly into the back, particularly in its acute phase, to have a direct effect on the back in itself. So that's where it has its advantage over your dry needling. However, dry needling can be effective if you combine the two in utilizing that to put needles into there to relax off the muscles more directly, and also to enhance or accompany the enhancement of blood flow to the back, particularly if you're looking at chronic cases. So again, that's something to bear in mind on that basis. Key thing about acupuncture, it's been practiced for at least 2,000 years. Some texts will say in the region of 8,000, 5,000, 3,000, but a minimum of 2,000 years. Training wise, you're talking a minimum of 3 years. Whereas regards to your dry needling, you're talking matter of days or a week at the most. So significant difference in the amount of training in which you need to complete in order to practice. Approach is more of a holistic approach. It does take into consideration emotional aspects, which is important, because if you look at the pain, the calmer the patient, the less pain they're going to actually experience. So they will address the emotional aspects, environmental aspects, and also the spiritual aspects, which dry needling don't take any of those into consideration. Treatment is mainly aimed at the root cause and not just at the symptom, whereas dry needling is more symptomology, pain related in its approach, whereas this will try to address more the root cause as to therefore getting more of a long-term effect as opposed to a short-term. So that's one of the key things. But however, one of the main thing is, if you are, let's say for example, you are a medical practitioner, you do not have to learn the classical acupuncture points from a TCM viewpoint. There is enough scientific evidence to explain what each one of those points will do scientifically. For example, a good point to start with is something like stomach 36. Stomach 36 is an effective point. So let's say for example, I have a patient that I'm treating, whether it's a lateral ankle sprain or it's post-operative knee. One of the key things you're going to want to restore is joint proprioception. Now, if you look at proprioception, that is controlled by the somatosensory cortex. So therefore, you would choose a point that would have a strong effect on the somatosensory cortex. The main point that has a strong effect on the somatosensory cortex is stomach 36. So once you start to look at re-establishing proprioception, stomach 36 is an excellent point for doing that, and that will outperform your dry needling. Same again if you're looking at purely tissue repair, That's where your stomach 36 and your spleen 6 will come into its own. So again, they will enhance tissue repair anywhere in the body. It doesn't have to be local to the area. They have been shown to enhance the tensile strength of tendon and also the repair rate of tendon and any connective tissue. That also includes bone. It will outperform those of you who use TCM. It will outperform points such as your kidney 3 and urinary bladder 23. Those 2 points have been demonstrated to outperform those 2 particular points. So again, you have got specific points. I could go through a whole list of them individually as to what they do physiologically. So you can choose your points based on its physiological effect. Now, if we start to look at similarities, so there are quite a few of the differences. So let's start to take a look at some of the similarities, because there are a number of similarities. Both of them will enhance circulation. If you're doing classical acupuncture points local to the area, they will enhance circulation. That's part of what you're going to be doing if you're treating it from a musculoskeletal viewpoint. It will have a local effect. It will also have a segmental effect. So if you're treating on a pain basis, it don't matter where around the knee joint you put the needle, whether you put it into a classical acupuncture point or just dry needle around, both of them will have a segmental effect on pain. So again, it will also stimulate local blood vessels and also local nerve endings. So again, there are the key similarities. There are other similarities is to say, for example, if you're looking at myofascial trigger points and classical acupuncture points, they both have similar structures that lies within the local area. So such as peripheral nerve junction, they will lie in the local area. Blood vessels lies close to acupuncture points, and also myofascial trigger points. Neurovascular bundles containing large and small sensory nerves that have a nociceptive feedback lies very close to acupuncture points and myofascial trigger points. So if we start to look at their location and distribution, pain and referred pain patterns are very similar. Local twitch response you will get from both a classical acupuncture point and also a myofascial trigger point. As we actually come on to that, if we look at the correlation, now quite a few studies have correlated classical acupuncture points with motor points, and authors such as Lou do state that there's a high correlation. Now, I'm sure you're all familiar with Melzack once you start to look at the pain gate theory. Now, Melzack did a number of studies, and they have put that there's a strong correlation, quoting 71% correlation between myofascial trigger points and acupuncture points. Same again, Dorsha did a number of studies, and they're quoting 93% correlation between a myofascial trigger point and a classical acupuncture point. Now, in my eyes, that was quite a lot, and I'm sure in other practitioners' eyes, particularly if you're doing traditional Chinese medicine, you'd think that is quite a lot. Now, you have got the likes of Birch that went out there and analysed the studies by Melzack and made it quite clear that they could only be associated with Ashi points, and also the fact that that correlation is only in about 18 to 19% correlation. Now, myself, I've recently published a book in 2018 which covers your myofascial trigger points, your auricular points, and also your classical acupuncture points, but presenting the classical acupuncture points from more of an evidence-based as to physiologically what they actually do. Now, based on that, and based on the information that I was getting with regards to your myofascial trigger points and what Melzack put out there, I also find, similar to Birch, looking at just short of 300 points in total, that there's a 19.8% correlation. So that's pretty much what I came up with. Now, just going back to the study by Melzack, the key thing is the study by Melzack, the text in which they used at the time, the images and literature wasn't that clear. So what they basically did was use it within a 3 centimeters. Now, 3 centimeters is quite large. So as long as that trigger point fell within 3 centimeters of the acupuncture point, they classified that as a correlation. Same again with dorsha. They did the same thing, classified it as a correlation, and they came up with 93%. Key thing is, as that centimeter got smaller and smaller, down to 2 centimeter, then dorsha was showing in a 30 to 40% correlation. As it got down to 1 centimeter, then again that correlation got smaller and smaller. The correlation that I used was half a centimeter. If it fell within half a centimetre, then I classified that as a correlation. So do bear that in mind. 3 centimetre is quite a big area to classify to me as a correlation. One of the key things I do say, there is strong correlation along the small intestine meridian. So if you're looking at small intestine, 9, 10, 11, 12, 13, 14 and 15, those classical acupuncture points sits directly over myofascial trigger points. If you're looking at urinary bladder 51, urinary bladder 23, again, they are also trigger points. So that is something you cannot ignore and cannot say that it doesn't correlate. They do correlate, but nothing like what Melzack was actually stating, or dorsha. So I'm hoping that does clear a few things up. But as I was saying, personally, if I had to choose between one and the other, I would say I would choose a classical acupuncture point over dry needling. But, however, I do choose my classical acupuncture points based on their scientific underpinning as to what they do physiologically, and choose them on that basis, as opposed to whether they dispel heat or whether they invigorate chi. So I don't tend to choose them on that basis. I do still use a scientific underpinning for the choice of those points, and I find by doing that I can get a treatment, a more effective treatment outcome. So that's pretty much how I tend to go about it. And again, from a Western scientific viewpoint, those of you who's doing dry needling, I do advise take on board your classical acupuncture points. It will transform your treatment and it will enhance your overall treatment outcome. Thank you for listening. Any question, then by all means you can contact me on info@stevebaileyAcupuncture.com.